who needs to have translation help. The mother, the woman has been diagnosed with end-stage renal failure after years or months of being tired. When she finally got to the clinic, she was told to have emergency hemodialysis. Of course, scared, and she said no. Until her friend and community leader came to go to the doctor with her. So her condition stabilized. Then she ended up with this huge medical bill. So I found myself on one hand talking English to the Wayne County case manager, my community leader talking Korean, translating for her. And three-way translation, we got the help that she needed. And see, this community, Korean community, they are from Burma, Myanmar, and it's war-torn. And they also were as an experiment for the malaria drug. So of course, that was has a huge effect on their trust rate. And 2022, when we first started mental health first aid training, started at NCCU. A Chinese professional came to our training, encouraged again by a community friend, a member. He had lost his wife to suicide. So years later, the son told me the mother never got therapy or any help, even though they're professionals. They have health insurance. Getting therapy is truly joyous. And also, this is not something that they want anybody to know. This is something that she unfortunately suffered in silence and died in silence. Two different stories and distinct barriers faced by two community members. Devastating health outcomes, unnecessary suffering from the end-stage renal failure for months, years, possibly, and loss of life. So when we're told that we can do identifying Asian American Pacific Islander health priority studies funded by the Blue Cross NC Foundation, we were thrilled because we wanted so badly to validate lived experience with science. So we got IRB approved by UNC Chapel Hill and used a RedCap translated into Chinese and Korean language and administer, we developed our own survey, administer communities by communities, table by table, room by room, just like the chef I studied helping the Korean young mom, middle-aged mom, I'm sorry. So the results show that we have 222 Chinese and 114 Korean refugees and 66 other Asians, including 10 Hmong refugees in the Lee's community. So we are still doing the preliminary data analysis. The results show that the health disparity, the barriers, vary distinctly among the subgroup. For example, Chinese, about 86% of Chinese has healthcare providers, but only 55% of Korean refugees. And the current insurance carrier, they have the insurance not also follow the similar pattern. So another finding that we find is that when the respondents ask what kind of things they think is going to help them, is the community education, including awareness training for health and mental health. Demographically, Chinese respondents tend to be older, and other Asian Americans tend to be younger. Another thing that related to the other Asians are that they have a much higher stress scale, perceived stress, 66 of them, remember? And also the other Asians experience much higher discrimination. This discrimination is related to the language, ethnicity, and their accent. So these are the major findings we have, and the implications. If you can raise the slide, the implications. Oh, sorry. So on multiple levels, right? So we're so glad that we heard the keynote speaker, Dr. Owens, and the Lincoln team. You always said, I don't need to talk about implications, you cover them all. So we know that trust is a daily, like Dr. Owen said, right? It's a daily work. It's not transactional. On the community level, absolutely, we need to continue to address the education and destigmatize in the area of mental health. On the health system level, policy level, please invest in the community organizations like the Lincoln team, community health workers, peer support specialists, the parents. These are the power within the community and the lived experience, and they have the trust built within the community so they can trust. These are the people are the navigators or bridges to the healthcare system, right? And on research, please desegregate data. We back very so widely. Asian Americans is the fastest growing population in the nation, also in North Carolina. This month, by the way, is Asian American, Native Hawaiian, and Pacific Islander Heritage Month. But every one of you, everyone has a role, right? Health disparity is a whole society effort. Everyone has a role, and with that, I want to thank my team, particularly Dr. Bob Wallen, who is from Duke Medicine, the co-author and founder of the flashlight, who had volunteered for this project for us. And Dr. Grace Wu from USC Chapel Hill, both of them served in my dissertation committee, and when she supposed to present here, last but not least, our amazing UCA WAVE team, and thank you, Reed and the media for coming. The communities we partner with, 12 community organizations, including the Korean Community Farming Old People. So thank you so much. I have 5 minutes for questions. Another thing that I wanted to say is that in vacations, I love to see this room, and I wear so many hats because I'm a faculty member at NCCU, and so many familiar faces. And also, I graduated from the PhD at USC Chapel Hill, and actually my second daughter also graduated from UMed, she now is a fellow. So I love to see the community, as you can all tell that everybody needs just team science. So we need to collaborate among our communities and across disciplines and go outside of this academic wall. I would love to see, Dr. Caleb, you said that we should, did you see that in the community clinics, right? In the community, a lot of people have mentioned that. I would love to see more community-centered clinic, or any these kind of conferences can be in the community setting. That would be awesome. I think there will be a lot more people will come.
Hi, thank you for sharing your experience. I was curious if you could speak to any work that you have with public health departments and how they are kind of evolving to kind of our evolving community here in this part of North Carolina as they're helping more dynamic community.
I love that question. I'm a public health nurse. I teach at NCCU Nursing, and we have a public health young team members here as well. Actually, we have someone from Wayne County Public Health Department coming here. I think that as an immigrant community, right, the biggest challenge is that the language barrier is well known. And also, I'm a first-generation immigrant, and I'm still learning. That's why I went back to school. I don't know. It's hard to wrap around such complex issues, and especially from the public health perspective. I think that the public health has I think every discipline has a role, but we absolutely have to address this issue from the public health perspective, the big picture, and from the system level to address that. We would love to, I think the public health in the local level, counties, even cities, or on the national level. I have spoken in the White House before and SAMHSA. I think that at every level, so we needed to make sure that people are on the same page. But let's not forget the community members. I was literally sharing these pictures to our WeChat. So that's an immigrant Chinese community, right? So that's what need to. So I always take pictures of all of Dr. Caleb's presentation. So yeah, I don't know if I answered questions, but.
I have a follow-up question. So this is a very, very interesting study and survey. What's your plan for follow-up? As you establish relationships with the community, seems like that would be a very valuable thing to then follow up in some way. And just related to that a little bit, are the Karen and Chinese communities in the area concentrated in any particular places that would make for a logical place to focus on for any follow-up?
Yeah, so love the question too. So as a CBO's community-based organization, we also emphasize on service first, right? And then we build evidence, help to build, but it has to be in that order. So we're dying to serve our community. For example, in the current community, this is the multi-pronged study. This is only a survey component, and we did the interview study focused on the listening section as well. On the interview study, which was my dissertation, the mental health. Oh my gosh, I can't believe mental health is the #1 health priorities that this survey respondents identified. Mental health, even though it's overall health. So we wanted to implement and educate this mental health, right? Decrease mental health stigma and save life. Just several months ago, a mom had 4 children die by suicide, living in Chapel Hill, not very far from UCA at all. We went to their house. There's possibly a lot of environmental toxins. You just smell the house and all that, right? This happened in our own community, and we're dying to develop strategies and interventions to help the community, but it's really difficult. Remember, the current community educational levels, the interviews I did, 23 of them, half of them didn't have any education in their own language of the parent, 12 parents. So a lot of barriers, and then also the manpower. For example, community leaders. I went, hey, Tucson, can you come to today's seminar? He had to farm. You know what I mean? So he couldn't come. So there's a lot of barriers. For the Chinese immigrant community, though, we are making great strides. Mental health first aid training, peer support, community health workers, one-on-one support, and we made a documentary film destigmatizing mental health. And obviously, we continue to do the research. We'd love to partner with you guys. Whoever wants to partner with us, come to see us. We're going to have an open house on Thursday, by the way. If you want to come and come to this table, we'd love to see you to build these connections, collaborations, and that's, I think that. So in short, I think we need to center the interventions has to be community-driven, co-developed, and evidence-based. And then also we need to continue to build partnership and based on trust, not transactions. That's a long-term relationship. Is aware that the open house is going to be our new small office in 800 Park Office Drive. I can give you the information. I don't want to take too much of time, but thank you so much for listening.